So one technique that I like to use is using my fingers to retract the cheek. And this technique you can use without a suction. You can have the patient bite down just a little and retract the cheek so that you can reach those back molars. So you'll just have the patient open, and I typically like to hold my polishing paste in my hand wrapped around my middle finger, and I'll take the prophy angle and just load it, and then we'll get started with the treatment of polishing the teeth. So you'll just load the prophy cup, retract the cheek, have patient bite down just slightly so you can reach those back molars. And then you want to take the polishing cup and just go right around the margins of the gingiva and clean the patient's teeth, making sure that you have a fulcrum the whole time. Luckily, this patient does not salivate much, but you can use a gauze and just touch the rheostat so that you can clean out the prophy cup if there is excess saliva. You'll reload and continue the process of going right around the gingival margin of the tooth and clean like so. Now, if you do have a patient that salivates a lot, you can use your suction to help with that. So I'm just going to clean her out so that we can show you the way to clean using the tip of the suction. With the suction tip, you can definitely retract the cheek as well. And you're also going to be using the suction to gather saliva as it accumulates inside of the mouth. So you'll just be following the prophy cup with the tip of the saliva suction. And as you are cleaning, you just want to go right near the cup of the prophy angle with the tip of the suction and gather saliva as it accumulates inside the patient's mouth. So it's a really simple procedure. I like to use it to retract and also to capture saliva as it is accumulating around the cup of the prophy angle. And these are a few techniques that you can use that'll help to, one, save time, and also it helps to keep things a lot less messy as you are doing your polish. The second technique is the one that I typically like to use the most when I'm using or doing a prophy on my patient. So I'm just going to show you one more time on her maxillary arch. You'll just take the suction tip, retract, and then you're just going to follow the cup of the prophy angle so that as saliva is accumulating around it, you can definitely clean that off with the tip of the suction. Perfect. And this pretty much concludes how I do a polishing on my patient and how I typically tend to keep it nice and clean, less splash as we are doing our prophy. Hope you enjoyed. Thank you.